Very good morning to all of you. Welcome to the Medico-Legal Conclave of Akriti. Akriti is a group of 18 friends who wants to do something different, not only sitting in a kitty and eating and chatting. In that way, the Akriti has come in front of you with the breast saga 6 months back, and today here we are with the Medico-Legal Conclave, which is today is the burning topic for all of us. We are wearing a sari which is not white. Why? Because the white color of a doctor is become red with the blood of red and become little bit dirty with the why? Who is at fault? Whether we or the society? I think somewhere us, because we don't go to the society and tell our part. Because of that, today's the Medical Legal Conclave is bridging the gap with the society, with the lawmaker, with the policy makers. And my request to each of you, very much in time, very crisp message to everyone. And the extra talking is a main culprit. What you talk unnecessary in front of the patient, what your staff talk, and this sometime take you to the court. So learn here first thing to give the crisp message, precise message, follow the protocols, follow the SOP and document everything.
Good afternoon, everybody. It has been a great pleasure to come here, and I must thank the Akriti Foundation for giving me this opportunity to speak. And presence of members of judiciary definitely enhances the quality of the information that is being dispensed to all of us. I am not a gynecologist, I am not a lawyer, I am a physician. I have completed my MD medicine and I am working at Kasturba Hospital as a senior specialist of medicine. Why I am here? In the audience, I think there are few persons who have heard me before also on this particular topic of medical negligence and medical law. And as till now has been discussed that medical law is not in our curriculum. We know very little about medical law. So what I am going to speak is notice served from court. This is of course not my expert domain because I am not a lawyer. It would have been better, it would have been covered by some lawyer. But still, I will speak on this topic from a physician's point of view, not exactly a lawyer's point of view. I am here because of this book. This book is Medical Negligence and Law in India. It has been published by Oxford University Press way back in 2010. This is a reference book of more than 20 to 30 top law colleges of India and equal number outside India as a reference book. I am basically fond of writing. This is my book on COVID. This is not yet available in India. This is the second edition that has been published by Routledge in UK and USA. So my interest is in writing and reading and writing, and whatever during this period I have learned about medical law, I am here to share with you. This is Oxford University Press in UK. It is the main gate. This is the Bodleian Library, the largest library. And this is London School of Economics, where my book is used as a reference book on the field of comparative law and South Asian law. So now I am going to talk on the steps. Whenever one gets a notice from the court, the panic sets in. So the first and foremost is not to panic. If someone panics, then the right decision is not taken. The moment you receive a notice from the court, the first thing that you have to do is note down the date and time of receipt of that notice. Because when you open it up, you may find that there is a time period of say 30 days by which you have to submit your reply. And often the notice, if it reaches late, you may not have enough time. So you have to pray to the court for giving you more time. So first is you write down the date and time. Next, please do not discuss with your case with anybody, not even your colleagues, immediate colleagues. Keep it to yourself, because you are the person who has been served the notice and you know what you have done during your treatment of the patient. The next step, the most logical step, is to inform your lawyer. Do not try to do anything of your own. If you have taken an indemnity, inform them, and the other person that you have to inform is the medical superintendent of that hospital, and this information should be kept as a confidential one and not to be discussed. Now, when you come across your indemnity lawyer, nowadays I can say that our members of legal fraternity are well versed with medical laws, but it was not the case about 15 years from now. When I wrote the book in the year 98, you will not believe it, when I first started studying about medical law, in the year 98, I went to the Delhi Law Faculty Library, and you will not believe it that in the entire library, I could find only one book on medical law, that too about 50 or 60 years back, written by, I think he was Ian Grubb, as far as I remember. And that is where my journey started. So at one end, there was no information, no knowledge, but now the legal fraternity is well versed with medical law, what to do and what not to do. Things have changed. So you should give all your thought process, share it with your lawyers so that they can defend you in the court. Now, once you sit with your lawyer, your main job is to write down the reply. It is a very typical legal procedure about which we physicians know very little. But what you have to do, basically, as a doctor, that you read each and every word of the complaint, each and every word, so that you can reply back in the same manner. Your job is to reply back in the same manner, in the same paragraph wise as the complaints are. So scrutinize the attached documents also very carefully, based on which the opposite party has put a case against you. You have to scrutinize those documents very carefully, and then you must check your records very carefully. A very simple example I am giving. Case sheet is there, which will be your exhibit. At the same time, what we forget is we do not take the nursing case sheet. They have also their records. You have written urine output 1.5 liter. In the nursing case sheet, the urine output is only 500 ml. So 1.5 liter and 500 ml, these type of discrepancies come out. So you must collect each and every case record from each and every possible places before you sit with your lawyer. Now reply, as I have said, that it should be for each paragraph, paragraph-wise reply. Deny the complaint completely if you think you are in a position to deny it, and when you deny it, attach your proof. This proof is very important. For example, breach of duty. Now breach of duty, how do you define the breach of duty? Breach of duty means you have fallen below a standard of care. Now what determines the standard of care? The standard of care is that of a reasonable doctor, not a very highly skilled one, not a very ordinary one. But to be on the safest side, if you wish to attach a proof, then use the textbooks, the standard international textbooks where you are following, and your work should tally with that. So if I am a physician, I will read Harrison, take the photocopy of that work, typhoid management, say ceftriaxone is the drug of choice. It is written there, and I have also given ceftriaxone. So I have followed the standard of care. And in the court you will see, when you show it, look, this is what is written in the standard textbook, our main textbook, and this is what I have done. So when you formulate a reply, your work and conduct, your treatment, that should match with that of the standard of care, and that standard is not our local textbooks. Please, in the court of law, when you are attaching a proof, it should be an international level, highly reputed standard textbooks which is used worldwide. It is no customary standard, it is the best possible standard that you have to use while you are working in a corporate hospital. Don't fall below that, because that is the most important thing that is seen. Because one important element of determining negligence is the breach of duty. And when we talk about breach of duty, we talk about standard of care. The standard of care is determined by the best possible treatment methodology. Now, if the complaint is vague, you may ask for further details. You are not able to understand the complaint, you can ask for the further details. If there are more than one medical professional involved, joint or separate version, that is the reply, may be submitted. All relevant documents should be attached and numbered sequentially. These are the most important exhibits. And what I believe, when you are attaching the exhibits, in the very first go, you attach whatever you think is going to help you in your defense. You may not get second chance. So in the very beginning, you attach all your documents in a very careful manner. Definitely your lawyers are in the best position what to attach, how to attach and everything. And in all these cases, if you think that the complaint is frivolous, then you can ask for some cost also. So this is very brief about what you should do. And be precise, be to the point. Do not write lengthy paragraphs which doesn't contain the basic facts. The basic fact the complaint is there, your reply should be either you deny it completely, or if you are not able to deny it, you have to accept it. There is no other way out. If the patient is dead, the patient is dead. If the patient had bowel rupture, the patient had bowel rupture. If the patient has injury to the bladder, the injury is there. So that is why in the first thing I said that what I personally believe, good documentation of the good communication with more than adequate disclosure of information. This is the best way to defend yourself. Because if you have not written down anything, the court will say that you have not done anything. And this is the usual ground where a case is lost. You will lose a lawsuit. So what I believe, if we follow these basic things without panicking, you are in a good position to defend your case, provided you have done your treatment in the right medical manner, as well as keeping the law in mind. To keep the law in mind, I am really saying that we are very poor in our legal knowledge. We practically know nothing. Many of us even have not read the Samira Kohli judgment fully. We have not read Jacob Matthew fully. We have not read Achutra Horiva Kodwa judgment in full. We have not even read IMA versus VP Shanta. There are two ways of learning law. One is the acts that are given out by our parliament. You read them word by word, you will know a lot. And you read 10 to 15 salient Supreme Court judgments. You will know it yourself. It is not a very difficult rocket science. It is very simple. You have to read it. And unfortunately, this is what we are lacking, and that is why we are landing up in court. And of course, there are many other problems also that we know, as I was discussing just a few minutes back, that in our day-to-day practice, even if I know the law, I am committing tort with each and every patient. Tort is the civil law of wrong. I am committing a wrong. I am even not able to take a history in details from the patient. The fault starts there and then only the moment the patient comes and sits in front of me because of the pressure. Hundreds of other patients are sitting behind her. So it is better that we learn the law properly, and this is the need of the hour. So this is how I conclude.